Okay. Thanks, Bethany. I really appreciate it. Thanks to the Mammon Family Public Library for hosting today and having hosted some of these discussions in the past. It's a really effective way for me to communicate directly with the folks in Bulverde and Spring Branch, Canyon Lake, and so forth, and talk about Medicare, which is a confusing subject for a lot of folks. I think because they get inundated with information in the mail. Some of it's scary. Some of it leads folks to believe that they're going to lose their coverage and so forth if they don't act absolutely immediately. But that's not the case. It's actually quite a simple program, and hopefully I can help provide some clarity for you. And if you have additional questions on some of the subjects that can be complex, we're here to provide those answers for you offline. So my name's Tom. I'm going to introduce myself, and then I'll go ahead and turn off the video. Like I said, the impetus today is to help you understand a little bit more about Medicare and introduce you to a family here locally in Bernie, in Bergheim, that can help you if you have any questions. My wife is actually on the phone with us, and she'll be listening and facilitating the discussion and helping me answer questions and so forth. She's also in the insurance business, the financial services business, and so forth. So she also has quite a bit of experience. So we live here in the Hill Country in Bernie, and we've been here for about 3 years. I'm gonna go ahead and stop my video, preserve bandwidth. We've been here for about 3 years after spending the better part of 2.5 decades in the military. And a lot of that was spent in the overseas environment. All of it since 2004 was working in the military health system, which you might hear the Defense Health Agency, what have you. Basically any of the medical components of the branches of the armed service. We really focused, I say we, because Kelly was also in the Air Force Medical Service and served. We served together. We spent most of our time in the primary care environment. We did spend some time working in the surgical environment, most of the time in the primary care environment. And our last assignment together was in Spangdahlem, Germany, where I had the distinct honor of serving as a squadron commander for our nation's sons and daughters. After that, I came back and I worked for United Healthcare in the operational environment, overseeing medical clinical care in the Dallas-Fort Worth area for a Texas-based senior medical group. My goodness, tongue twister. So I understand the clinical side of what goes on in the Medicare environment, meaning how does your insurance interact with doctors' offices? And I have a pretty good idea of how that occurs at large, and I have an even better idea of how it occurs in the Bulverde, Spring Branch, Canyon Lake area, because I just have so many folks that I have business relationships with there at this time. So I'll talk a little bit about what I want to do today, and my objective is to help you get to a point where if you needed to make a decision about Medicare, you could select a plan that best fits your needs, okay? And that really is the bottom line, because there's several variations in coverage types and products that can be used singularly or in combination with one another to provide you with the coverage you need under the umbrella we call Medicare or Medicare Advantage. I'm going to help you understand the elements of those and what the purpose of each of those is, what they cost, where gaps exist in that coverage, and understanding how those gaps can be filled and which products are available to fill those as well. During the presentation, should you have any questions at all, please just speak up or enter a chat into the chat box, and Kelly will see that, and if she needs to, she can interrupt me so that I can answer any questions that you may have. So, okay, what is Medicare? Do I even qualify it? I know I get stuff in the mail. It talks about what Medicare is and so forth. So I'm using a very simple presentation provided by United Healthcare Company called Medicare Made Clear. And I will cover probably half the slides today in the interest of making sure it's an efficient interaction. And then Bethany will make sure that the presentation is made available to everyone so you have it in its entirety. What Medicare is, all right, it is a federal health insurance program administered by the United States government, and specifically the Social Security Administration and the Department of Health and Human Services under the auspices of the Center for Medicaid Services. A portion of Medicare is funded by the taxes that you paid while you were in the workforce, and it also is individual health insurance. And it is not a family health plan. So if you are one member of your household who qualifies for Medicare because you are 65 years or older, or you have a disability factor that qualifies you for Medicare, it covers you specifically and not any other members of your house. It is not Social Security, but it works with Social Security. As I mentioned, Medicare is actually administered by the Social Security Administration, which is why if you were to make elections to enroll in Medicare Part A or Part B, you would do that via the Social Security website or ssa.gov. Medicare is not Medicaid. Medicaid is a program that is administered at the state level to provide healthcare services for those in desperate need based on disability or lack of an ability to pay for healthcare services. And lastly, and this one is something that I'm going to really hammer home, Medicare is not free, okay? You have paid for this benefit and you will continue to pay for this benefit, and I'm going to talk about that at length. So who can qualify for Medicare? U.S. citizens and legal residents who have lived in the United States for 5 years in a row, and very importantly, immediately, the 5 years immediately preceding the application for Medicare benefits. So, if you lived abroad and you were not a citizen of the United States and you gained residency and then you moved back abroad and then came back, you would have to be here for at least 5 years. And believe it or not, that does happen quite often here in Texas. We have folks that have family just south of the border, and they may spend a significant period of time there, come back here, and that could affect their eligibility. The other requirements being age 65 or older, or being younger than 65 with a qualifying disability, and any age at all with a diagnosis of kidney disease or Lou Gehrig's disease. There are two parts to original Medicare. The first is your Part A, which is hospital insurance. And you want to consider this or kind of characterize this as rent. And this is what is paid for when you are admitted to the hospital based on necessity. And the Part B is your medical insurance. And this is the insurance that's going to cover your doctor's visits and your outpatient care. So those are the two original components of Medicare that you can sign up for at ssa.gov. Hospital insurance is generally premium free if you or your spouse worked and paid taxes for 10 years or longer, or you might hear it described also as 40 quarters of qualified work experience, because each year is equal to 4 quarters. You cannot be denied coverage for Medicare Part A or Part B based on a pre-existing condition. So regardless of what you might have heard in the political environment from one candidate saying about another candidate, both of the political parties have championed and pushed for coverage of folks with pre-existing conditions, and you currently cannot be denied coverage based on a pre-existing condition. So please keep that in mind. There is quite a bit of information that can land in your mailbox that might lead you to believe that that is not the case, and it is just not the case. Now, for original Medicare, your coverage is nationwide, meaning that you can seek care in any institution in the United States that has been qualified by the Center for Medicaid and Medicare and Medicaid Services, which are most of them. And you can get care from anyone who is registered as a CMS or a Medicare provider. You can also get care from non-registered CMS providers. There just might be a slight difference in the cost that you would pay for that care if you were to get your care from someone like that. Coverage and costs are per benefit period for Part A. And essentially what that means is from the day that you are admitted to the hospital until 60 days after the last day you were discharged from the hospital would be considered one benefit period, okay? If you were discharged from the hospital and then 65 days eclipsed between those two periods, you would start a new benefit period, which would mean that you would incur new costs. And we're going to go into detail on that as well. You must be admitted as an inpatient in order to start a benefit period, not simply be in an observation status or what some people might call a 2359, meaning that you're in the hospital for less than 24 hours. Original Medicare also provides an additional 60 lifetime reserve days, but those are quite costly, and we're going to talk about that cost structure in a minute. The other part of Medicare is Part B. This is the part that most people are familiar with and that most people use on a regular basis. This accounts for about 90% of the interaction that you're going to have with a medical professional while using Medicare. Now, the big difference between Part A and Part B, as I mentioned before, Part A, your premium is covered by the time that you spent in the workforce. So when you looked at your pay stub, over the last 10 years or more, and you saw that there was a deduction taken out for Medicare, that was to support the national system and also to pay for your Part A, okay? Part B is different. Part B comes with a monthly premium, okay? And that monthly premium is adjusted for income. Generally speaking, most people fall into the cost base for Part B, which is just over $150 per month. If you make a significant more amount of money, your premium can actually be as high as over $300. And I have that information that's available as well if you have any questions about that. As I mentioned before with Part A, you cannot be denied coverage with Part B, all right, regardless of pre-existing conditions. And as with Part A, coverage is nationwide, including any provider who accepts Medicare, and most do. Okay, there's very few that do not, but most do. And there is a premium penalty for late enrollment into Part B. So if you elect not to take Part B, it can add up and add about 10% additional cost expenditure to your monthly premium for every year that you're not enrolled. I can go into great detail with that if you have any questions about that, because that can get a little bit complex. These are the four different costs in Medicare. You have a premium, the deductible, the copay, and the coinsurance. So just like you would have with P&C, property and casual, there's a premium that you need to pay per month, i.e. with your Part B, and then there's a deductible. So many of the plans that exist in the Medicare environment, as well as original Medicare, do have deductibles, which is a set amount that you pay for services before Medicare or the plan begins to pay. And then there's a copay. You've probably experienced this before if you're on an individual health policy or on a group health policy. it's a small amount that you pay at the time that you receive a covered service, 10, 15, 25, $30, and maybe a little bit more for specialists. And then co-insurance is the cost share of a covered service that is split between you and the payer. When the payer is original Medicare and the individual is you, generally speaking, that co-insurance or that cost share is covered under an 80-20 schedule, meaning that Medicare pays 80% of your bill and you pay 20% of your bill. Now, that is a pretty good deal, but it can be costly. One of the questions we should always ask ourselves is 20% of what? All right, 20% of $100 probably palatable. 20% of $1,000, it's starting to get a little bit more concerning. There are ways to hedge against the anticipated cost of that we'll talk about in a little bit. So for Medicare Part A, your hospital costs, there is no premium for most people. It's covered by your payroll deduction in your work experience. There is a deductible. If you got admitted to the hospital, you are going to pay $1,340 deductible, okay? And then you are going to pay $335 per day once the 61st day has been achieved, if you were to be in the hospital for an extended period of time. So deductible, 340 days, then you're covered for 60 days. Days 61 through 90, $335 per day. And then the lifetime reserve days that we talked about on the Medicare Part A overview slide is $670 per day, right? So for a period that extends out to the 150-day time frame, let's say that you had a catastrophic injury or an illness and you were in the hospital for this 150 days under original Medicare, that's going to come out to about $40,000, okay? That's a lot of money, all right? And there are ways to avoid having to endure something like that. However, I want you to consider that the average cost for a stay in the hospital is right around $10,000 per day. So you can do the math on that. 150 days times 10,000, it kind of makes that $40,000 seem somewhat reasonable. But still, I know personally for me, if I had to chalk up $40,000 to pay for a 150-day hospital stay, that would have a significant effect on our financial well-being. And I would be looking for ways prior to going into the hospital to hedge against that. A cost example. So as I mentioned before, all right, there are benefit periods. And this one is about a guy named Matthew. He's admitted to the hospital in January and stays for 5 days. Readmitted in April and stays for 65 days. Since more than 60 days passed between Matthew being released and readmitted to the hospital, that means he is accessing the Medicare Part A benefit twice. There's 2 benefit periods. Okay, so for the first one, he was only in for 5 days. So he is only going to be spending out of pocket $1,340 for the deductible. On the second day, he's going to pay that deductible again. Remember, new benefit period. And then he needs to pay for days 61 through 65, which is 5 days at $335 per day, totaling $1,675. So since he was admitted in January, and when he was discharged after that fifth day on the second benefit period, Matthew's going to end up paying about $4,355 out of pocket as his cost share for the Medicare Part A benefit. Again, a lot of folks could probably handle $4,355. There's a significant cohort that could not. There are tools that we have that can help you avoid this cost, and we'll talk about those. Part B, as I mentioned before, the Part B premium, this is the 2018 cost schedule. It's actually the Part B premium now is $153 per month for most periods, and your deductible is $197 per month, or per year. I'm sorry, I need to get the slide updated. Other costs, as I mentioned before, is the 20%, the cost share, all right? And Medicare picks up 80%. Important to consider for Part A and Part B is that there is no out-of-pocket limit, okay? So as with many of the Medicare Advantage plans that are available that do have out-of-pocket limits, under Original Medicare, there is no annual out-of-pocket limit for the costs that you could incur for medical care, all right? So there are options for more coverage. When you look at that, you go, man, you know, $4,300, the potential of a 150-day stay costing me $40,000 as a consumer. You know, I've got a fixed income. I'm nearing retirement age, or I'm already in retirement, and I have not planned for $4,000 coming out of my pocket, let alone $40,000 coming out of my pocket. What can be done to provide a safe haven for my finances in the event that I need to seek medical care that can help with my Original Medicare plan? Well, there's a few options. The first is enrolling in a Medicare supplement plan, a standardized supplement plan that helps to pay for out-of-pocket costs that are not covered by Original Medicare. All right, so enrolling in a Medicare supplement comes with a monthly premium requirement, but it will very significantly hedge against some of those high costs that we talked about before, and I can go into more detail on that. And Medicare supplement plans are good for some, but not for others, and there's a few factors that go into that, and it really comes down to lifestyle. Notice that I have not mentioned up to this point coverage for prescription drugs. That's because Original Medicare does not cover prescription drugs, all right? It's the responsibility of the consumer to enroll in a Medicare Part D plan, which is really kind of a play on words. It's not Medicare Part D, meaning that it's not administered by CMS or the federal government. Medicare Part D plans are offered by private companies such as Humana, Aetna, Cigna, United Healthcare, and so forth, and they help pay a portion of the cost for your prescription drugs. Those also come with a monthly premium if they're purchased independently. Option 2 is to enroll in a Medicare Advantage plan, and these are also offered by private companies, just like the supplement plans and the Part D plans. These combine your Part A and your Part B in one easy-to-use plan. They generally include a prescription drug coverage option, although there are some that are just your Part A and your Part B. And I just wanted to make a comment very quickly as well. Since we live in Military City, USA, and there's literally veterans sprinkled all across the Northern Hill Country, and especially in that area around Spring Branch, Bulverde, Canyon Lake, and so forth. A significant number of the clients that I have are either retired military or have VA benefits. There are now plans constructed by some of the major carriers that do not include a prescription drug plan that allow you to continue to use your DoD benefit or your TRICARE benefit. And those can be very lucrative. They can help save you money, and in many cases, the carrier will actually pay a portion of your Part B premium if you enroll in one of those plans because they're saving the money that you would be spending on prescription drugs, right? Another thing to think about when it comes to Medicare Advantage plans is they've vastly improved over the last decade. 10 years ago, you'd be hard-pressed to find a Medicare Advantage plan that covered anything but your Part A and Part B. Now, most of the plans are catering to a more active lifestyle, folks that are living quite a bit longer that still need things like dental care, help with paying for their contact lenses or glasses, and then also help with hearing, including basic exams for dental, vision, and hearing, transportation to and from the doctor, in some cases, assistance with meals following discharge from the hospital, and many of the Medicare Advantage plans also include a membership to just about any gym in your area. And there's several different names for those programs, each of which is branded by the major carriers. So Medicare Advantage plans now are just really, consumers are benefiting from those companies doing battle, trying to offer the best benefits to all consumers at the very lowest cost. And the plans have just improved drastically. I know of several people that have enrolled in Medicare Advantage plans that did not know it was possible to gain some access and fairly good access to dental, vision, and hearing care. They just didn't think it was an option, but it is a reality now. And if you have questions about that, we have a myriad of plans that we can go over with you as well. As I mentioned, Medicare Advantage includes all the benefits of Part A and B, a lot of times prescription drugs, dental, vision, hearing, wellness programs, and fitness memberships. And another thing is that's different from original Medicare is they have out-of-pocket limits to help protect families on the cost of healthcare over the period of a year. And you could literally spend, based on your health or your need to access healthcare under original Medicare, you might spend $100,000 in 1 year for your medical care. Under Medicare Advantage plans, they have out-of-pocket limits, usually in the $5,000 to $7,000 range, which places a cap on the amount that you can spend on care under the auspices of the plan. And like Medicare Part A and Part B, all Medicare Advantage plans are guaranteed issue. Okay, you cannot be denied cover based on a pre-existing condition. Medicare Advantage plans, in my opinion, offer a very convenient, clean, and easily accessible healthcare plan for folks and help demystify the environment of accessing care under Medicare. Some facts about that that I already mentioned about Part A and Part B. You may be required to use a provider in a specific pharmacy network if you're enrolled in a Medicare Advantage plan. The goal of a Medicare Advantage plan is to keep you well and drive down the cost of care by keeping you out of the ER, keep you out of the hospital, and enrolling you with a provider that the carrier contracts with, and also directing you to pharmacies that they broker discounts on pharmaceuticals so that they can pass on the best cost for prescription drugs to you. Coverage and costs vary by plan and do change each year. The number of Medicare Advantage plans that are available right now for a zero premium per month are really flabbergasting. Just about every major carrier in the very rich San Antonio, Austin area offer exceptional plans that require no monthly premium out of your pocket. Okay, so just think about what I said. Part A, Part B, dental, vision, hearing, transportation, meal assistance, gym membership. Some offer stipends for $40 to $50 per quarter for over-the-counter products, and that is no additional cost to you per month. So all you do is you pay your Part B premium, enroll in the plan, it's clean, and you have a vast list of resources available to you. Okay, so that's generally speaking about Medicare Advantage plans, not any specific plans for specific carriers. I can't provide that to you. If you want to talk about specific carriers, we can talk about that after the meeting, or we can set up a time to chat about that. Again, there are annual limits on out-of-pocket costs under Medicare Advantage. Some charge a monthly plan premium, not many. If you're paying a plan premium, I'd really ask why. And you must continue to pay your Part B premium. This is a good opportunity for me to mention that as sure as the sun rises, there's things that we do every day. We breathe, we eat, we sleep. And if you're enrolled in Medicare Advantage or you're enrolled in Original Medicare, you are going to continue to pay your Part B premium for the rest of your life, okay? Unless there are very extenuating circumstances, paying your Part B premium is something that is a fact of life once you turn 65. So we talked about Original Medicare, Part A and Part B. We talked about a Medicare Advantage plan. And then there is a standalone Medicare prescription drug coverage plan that's available as well. Okay, you can add this to Original Medicare in order to drive down the costs of your prescription drugs. And you generally can get your drugs from HEB, or you can get them from, the Spring Branch Pharmacy, or, CVS or Walgreens, anything that's on 281, 46, Bernie, Boulevardy, what have you. Most of the prescription drug plans allow you to access those, and you pay a portion of your prescription drug coverage or a copay for your prescription drug plans after you've paid a moderate monthly premium. As I mentioned before, these plans are covered by private insurance companies. The cost of drugs is based on a tiered schedule of costs. Tier 1 meaning these are low-cost drugs and so forth, and increasing in cost all the way up to Tier 5 for treatment of complex diseases and sicknesses and so forth, and then in some cases, drugs for chronic conditions such as diabetes, heart disease, cancer, and so forth. And this is the schedule that is established by the federal government under the Center for Medicare Services to determine the appropriateness of cost for drugs in a standardized manner across the United States for all consumers, right? And what they do, what this enables you to do is have consistency of the amount of money that you're going to spend for your drugs when you pay your copay and you go to the pharmacy. And as I mentioned, these increase from Tier 1 up to Tier 5, and there actually may be incremental changes in deductibles. Remember, I mentioned deductibles earlier, based on the drugs that you are receiving. So you may have a lower or no deductible for a Tier 1 or Tier 2 drug, and you may have an increased deductible for a Tier 4 or Tier 5 drug. That is without question the most confusing part of Medicare that I can provide you with much more explanation should you desire it. And I do have some good videos as well that help provide clarity on that, because it can be complex. There is what is called the donut hole that exists. You've probably heard lawmakers talk about this, closing the donut hole and so forth. Essentially what it is after you pay your annual deductible under your prescription drug plan, you have an initial coverage stage that covers you all the way up to a pre-stated amount, which is generally around $3,750, okay? From that point up to about $5,000, you're going to experience an increased out-of-pocket cost for your prescription drugs, okay? And then once you exceed that limit, you enter what is called the catastrophic coverage stage, which in that stage, you pay nearly nothing for the drugs that you have. The coverage gap, i.e. the donut hole and the coverage stages, are based on 1 year of coverage, okay? And the most important thing, I think the biggest takeaway here that I've been mentioning to folks for since I've been doing this is nearly 90% of folks get all of their drugs in the initial coverage stage. And many of the folks that are enrolled in these plans that I've assisted, in the Spring Branch area, are on Tier 1 or Tier 2 medications, and they don't even qualify for a deductible. So they pay a very small copay when they go to the pharmacy and they get their drugs, and there's no issue. Really, Part D prescription drug coverage is the cost associated with that is based on what your current health status is. It's definitely going to be different from someone who is dealing with a chronic sickness than it is for someone who doesn't have any underlying health factors. Again, I'm available to talk you through the Part D coverage stages and talk to you about the donut hole. And I even have a tool, several tools actually, that I can plug prescription drugs into and give you an idea about how much you're going to spend each year on prescription drugs. So just kind of a recap about prescription drug coverage. You may be required to use a specific pharmacy network, and costs can vary each year. There is a very small Part D premium penalty for late enrollment, and I mean very small. It's very very insignificant in the grand scheme of things, but it does apply, and I can provide you with information about that. And you must continue to pay your Part B premium to Medicare. As I said before, sunrise, sunset, taxes, so forth, must pay that Part B premium and cannot stop that. So, okay, I saw a chat, just Kelly sharing my calendar with you. All right, so we talked earlier about the coverage options. There is one other option that I haven't discussed yet, and that is enrollment in a Medicare supplement plan. You've probably seen this on TV, folks talking about supplements and so forth. This is not the same as a Medicare Advantage plan, okay? In order to enroll in a supplement, you must be enrolled in Part A and Part B and live in the state where the plan is being offered, okay? And what this is going to do is it's going to help pay your deductibles, your co-pays, your co-insurance, medical transport, and so on and so on. So this essentially is going to cover down on that 20% cost share that I mentioned that you are liable for when you're under original Medicare, okay? The good thing about Medicare supplement insurance plans are that you can literally see a doctor anywhere in the continental United States or a U.S. territory that accepts Medicare, and you're going to pay nothing for your medical care. After you've paid your Part B premium, after you've paid your premium for your supplement, you simply go to the doctor, show them your Medicare supplement card, and your medical care is covered. I can speak from experience. I talked at length with my mom about this, who lived in a different state prior to moving to Texas, and she said the supplement plan was as advertised, and she got care at some, what I would call some pretty highbrow or well-named institutions in the United States. And the Medicare supplement covered all of her costs in the surgical environment, in the inpatient and the outpatient environment. Medicare supplement insurance plans are great for active folks who still like to travel, right? Say you spend 3 months each summer, June, July, and August up in the Upper Peninsula of Michigan or Maine to keep cool. You can take that Medicare supplement insurance plan and you can get all your care while you're on vacation. You do not have to worry about a network as long as that doctor accepts Medicare, which most of them do, okay? Plan premiums are of different levels of coverage, and therefore they cost different amounts, okay? Plans that offer more coverage generally have higher premiums, just like with an insurance policy that you'd have for homeowners or your automobile. And again, as we've mentioned before, you must continue to pay your Part B premium to Medicare in order to stay enrolled in a Medicare supplement. Okay, so this is kind of this is everything on one slide here. What we've talked about so far is original Medicare, okay? 65 for qualifying disability, you enroll in Part A and B at SSA.gov. Okay. Then, if you want prescription drug coverage, you can add a standalone prescription drug plan. If you want prescription drug coverage and coverage to pay your cost share of original Medicare, you can purchase a Medicare supplement. If you want to just stay on Part A and Part B original Medicare and enroll in a Medicare supplement without a prescription drug plan, you can do that as well, and you can pay for your pharmaceuticals out of pocket. I've had lots of people ask me about this. They say, I don't have any medications, I don't take medications, I don't want to pay for it. This is an option, but there is a small penalty that you'll have to incur once you do enroll in a Part D plan down the road, if that's what you decide to do. The three options under Medicare Advantage is a plan that covers your Part D as well. And you'll often hear Medicare Advantage plans be described as Medicare Part C. Again, that's a bit of a play on words. It's a Medicare Advantage plan is not a component of original Medicare. It's a plan that you buy from a private carrier, which covers your Part A and your Part B, and oftentimes includes a Part D. Although I did mention that you can buy one with just Part C, and then you can buy one with Part C. Not exactly sure why you would do this unless you had someone sponsoring your Part D plan. You can also have a Medicare Advantage plan without a prescription drug plan, and then you can choose to enroll in another Medicare Part D standalone prescription drug plan. So those are the 7 major coverage combinations that you can use. The steps to this are enrolling in the original Medicare, as I mentioned, either when you turn 65 or you become eligible based on disability, and you do that at ssa.gov. And then step 2 is deciding what option that you need. And I really would recommend for folks that are concerned that they don't have all the information to talk to a licensed agent about what option is best for them and which one makes the best fiscal sense for you. And we're certainly available to do that for you. There are enrollment periods when it comes to Medicare. The initial enrollment period is when you turn 65 years old, the 3 months immediately preceding that month, and then the 3 months after. So this is essentially a 7-month window. You can actually have your Part A and Part B, or actually your Part B costs deducted directly from your Social Security check, and you can enroll yourself, as I mentioned, at ssa.gov or a local office. I do want to mention that most Social Security offices in the San Antonio area are still not accepting walk-ins. You can also call those offices and enroll over the phone. You do want to ensure that you're enrolling early. I recommend that you enroll in Part A and Part B as soon as you become eligible, which is the 3rd month preceding your birth month. And you can enroll, you can actually refuse or delay your enrollment in Part B if you are still working and you are a part of a group health plan. So let's say you work for the San Antonio Water Systems or the Teachers Retirement System here in Texas, and you get your primary care coverage through a group health plan or an employee health plan. You can continue to use your employee health plan and not enroll in Part B, and you will not be subject to a late enrollment penalty. Okay, and then also during this initial enrollment period, you can enroll in what we just discussed with the Medicare Advantage plan. The general enrollment period, which occurs every year, are for those who miss their initial enrollment period. So if you miss your initial enrollment period, you may have to wait a few months to 1 January through 31 March every year when you can enroll in Part A and Part B. Subsequently, you can enroll in a Medicare Advantage or a prescription drug plan April through June of that same year. Okay, so it gives you another opportunity to do that. As I mentioned before, some late enrollment penalties may apply, and we can answer those questions for you. Medicare Supplement open enrollment is just a little bit different, meaning that you don't have the 7-month window that you had under the initial enrollment period. You don't have a 3-month enrollment period under the annual enrollment period, you have a 6-month window starting on your birth month and then extending 6 months into the future, okay? Now, the important thing to mention here is if you decide that a supplement is right for you because you travel and you go back to Michigan 3 months per year to enjoy the cool weather, all right, you will undergo no medical underwriting. That means no physical exam, no questionnaire about your health status or anything, as long as you do it within 6 months of your birth month. After that, you can enroll in a plan or apply for enrollment into a plan, but you could be denied or charged more based on your health industry. This is the big difference between Medicare Advantage and Medicare supplements. This is a huge takeaway item, a foot stomp, or something that I really want you to remember. If you're considering a Medicare supplement, remember you have 6 months, including your birth month and then extending into the future, a 6-month window when you can enroll under what we call guaranteed issue. You're definitely going to be able to enroll in a Medicare supplement plan. After that time, it's up to the company based on your health history whether or not they're going to allow you to enroll. All right. And there's also special enrollment periods that are available for a variety of reasons. I already talked about the work history, which is talked about here. You essentially have 8 months to enroll in Part A and Part B after the last month of your employment or employee health coverage, meaning you may work for San Antonio Water System, retire in January, but your health care coverage is extended until April. That means that you have 8 months from April to enroll in Part A and Part B, okay? However, if you want to take advantage of a Medicare Advantage plan or a prescription drug plan, you have to do that the first 2 months, okay? So there's a bit of a catch-22, right? And late enrollment premium penalties. The big one I want to talk about here, and I can go into details with any of you offline if you want to talk about those, is here in the center, Medicare Part B, okay? If you do not enroll in Part B and then you decide to enroll in it 3 years after the fact that you had qualifying coverage, so you're now 68 years of age, you've gone 3 years without coverage, Medicare is going to tag on an additional 30% onto your premium, okay, 10% per year. So if the Part B premium, the year that you were eligible to enroll in Medicare was $150, all right, and then going up from that time, there is going to be an additional 10% per year penalty that is attached to your Part B premium, which never goes away. So that could be as much as $50 per month extra that you pay on your Part B premium. The reason they do this is CMS and the federal government want to encourage enrollment into Part B in order that people can access their primary care doctor and they don't end up in the hospital or the emergency room. So a little way of, quote, incentivizing enrollment in Part B. The big one that clogs up your mailbox every year, Medicare open enrollment. You can switch from original Medicare to a Medicare Advantage plan during this time, or vice versa. You can switch from one MA plan to another. You can join, switch, or drop a Medicare prescription drug plan. You can pretty much do anything in this time period. All right, so that's the one where you see Joe Namath on TV and he's talking about all the benefits of Medicare Advantage and so forth. And it seems like every other piece of mail that you get in your mailbox, if you're between the age of 64 and so on, is something about a Medicare product. There's a myriad of special enrollment periods, which include moving out of a planned service area. Maybe you're one of the many people that has just recently moved from California to Texas. That would qualify you for a special enrollment period. Losing your retiree union or COBRA coverage, moving back to the U.S. after living abroad, or in some cases even being released from incarceration. That is a qualifying event or a special enrollment period. There are a few others. I've worked in complex environments and worked with some of the major carrier help desks to find out if folks were eligible for qualifying events. And believe it or not, there are many that are not listed here, especially those that folks that reside in planned service areas that were affected by natural disasters. There's actually right now a special enrollment period for folks living in the San Antonio metropolitan area because of the winter storm that we had, because that knocked out a lot of people's internet, electricity, slowed their ability to access healthcare resources and so forth. So there either still is or just was in a special enrollment period for that for most of the carriers. There's also financial assistance programs should you have any questions about your eligibility. Some of those are the extra help that you can get for drug costs if you are if you reside or you don't have means to other financial assets. Medicaid, which provides health care coverage for folks with limited incomes, that's administered at the state level. So Medicaid would be Texas Medicaid. Medicare savings programs that help you pay for Part A and Part B should you qualify based on certain disabilities. And then all-inclusive care for the very elderly that are living in the community as well. There are additional financial assistance programs, many of these, most of which when I'm asked about, I actually end up getting on the phone with the consumer and the carrier to make sure that we didn't miss any benefits that may be available. So I know that was a lot of information packed into a short period of time. My goal was to get to the hour, and I think that's the first time I've done it. I was able to get it done in an hour. So I'm going to go ahead and bring my video back up and open up my screen so that I can talk to everyone. Can everyone see me?
Yep, we see you.
Okay. All right. So I am willing and able to answer your questions now. Any questions that you may have? Anyone?
This is Kevin. I don't have any questions. I think that was really well done. Very clear, very well organized. Just now need to go internalize some of the data and make some decisions. It does great overview. Okay. Thank you.
You're welcome. Yeah, thanks for that comment. It is a simple program made confusing. I truly believe that. Okay, when you break it down to its most critical elements, it's really not that difficult to understand. I think it's the volume of information that consumers get in their mailbox through their email and TV that makes them feel as though they don't have the information they need and can be very intimidating. Matter of fact, so intimidating sometimes that folks just throw up their hands and they don't enroll at all. And then they're in the lurch. And then they have a serious coverage gap that exists.
I do have one quick question. What are the income tiers for Part B? So you mentioned 134, 150, and up to 300 for premiums. But,
yeah.
What are those tiers?
What is what? I'm sorry?
What are the income tiers that take you to different premium levels for Part B?
Well, for you, I'm sorry, you were a little bit garbled coming in. Did you say Part B?
Yes.
Oh, okay. Actually, I can show you here. Let me go ahead and bring something up here. And let's do open something up here. Okay, so I've got a little, all right, so I'm going to make sure that my share is here. Okay, so can you guys see this right here?
Yep.
Okay, so I'm going to blow it up just a little bit. This is the 2021 Part B chart, okay? And so, and it reflects the income adjustments, or IRMA, okay, IRMA. So essentially what this means is if you file individually and make $88,000 or less, as I mentioned, it's around 150 bucks, actually $148.50. Okay. If you eclipse that amount, you're going to jump up to 207. You eclipse all the way up to 111,000. You eclipse that amount, it goes up again and up again and up again. And you can see it goes all the way up to $504. Most of the consumers that I've dealt with, I think the highest I've encountered anyone is this one here, the $386.10 for a couple that was filing jointly. So him and his wife actually just turned 65 and both qualified for Medicare. So at least for the first 2 years of their retirement, they were going to be paying that in their Part B premium until their income regulated. And what I mean is they had to take a distribution on their income, which increased their income the 2 years previous to enrolling in Part B, which boosted up their income bracket. I think it's next year they're going to drop down to where they're paying about $207 per month. So as you can see, it is costly, as with many federal programs. The folks that make more money are going to pay more. There's no exception here with your Part B. Does that help answer your question?
That's perfect. Thank you.
And it does adjust downward as that changes.
Yes, it does. Yeah, so it doesn't mean that you entered the system making filing jointly $295,000 a year, and so you guys are going to pay a Part B premium of $386.10 per month in perpetuity. Once your income reduces, you are going to pay the appropriate amount each month in Part B premium.
And it looks like it's a year behind. So what you did in 2019 is 2021. What you do in 20 is 22.
That's correct. It's 2 years behind. Yep.
Okay, and that's adjusted gross income?
It is. Is that correct, Kelly?
Hi, it's actually modified adjusted gross income. Yes.
Okay, modified adjusted.
So I had one other question, if I could. So my wife is younger than I am. I robbed the cradle. So when I go on Medicare, she still has to have her own insurance. Then there's no way to combine this. We have to wait till she turns 65 for her own Medicare.
Yes, your wife will become eligible based on her 65th birthday or a qualifying disability.
Got it. Okay.
Yeah, and that's a tough conversation to have, because individual health is it can be quite costly. My recommendation for folks that are asking that question, look at healthcare.gov at the exchange. Right now, that'll at least give you an idea of the costs associated with that, so that you can make informed decisions. There's reason for celebrating turning 65, and one of those is accessing your Medicare benefit, because it is a very thorough, comprehensive, and good benefit.
Yeah, perfect. Thank you.
Of course, my pleasure.
So, Tom, you said that you were with United Healthcare at some point. I noticed that some of your presentation slides were still United Healthcare or provided. Are you an agent with them still?
I'm an I'm an independent agent, Mike.
Uh-huh.
That is an industry-wide approved generic
Okay.
presentation that is produced by United to provide an overview of the Medicare system and the additional products that can be added to original Medicare. Humana has a very simple presentation that's similar. Aetna has a presentation that is similar. They're almost identical with the exception of the background color and so forth. I find the United one to be the most clear.
Okay.
It's my intent to make it as clear as possible when it's already as clear as mud. So
And
that's why I use it.
Are you aware of, for example, I retired from AT&T.
Okay.
And one of their, so I'm coming off of their insurance,
Right.
but one of the things that their information that they're sending me deals with United Healthcare because they're, I guess, have some kind of either a supplemental or an advantage plan. I'm not sure, but are you familiar with other companies that if we have a side conversation, you're capable of explaining what is currently covered by these other companies? And I'm not talking about the insurance companies. I'm talking about businesses where people are,
Yes.
where we're coming off of a company provided plan to something different.
Yes. As a matter of fact, I do have a client that's a former AT&T employee as well. And that client had a similar experience. We were able to do an analysis of that group health plan. And that was, and that helped that client make an informed decision about which plan they wanted to be affiliated with. I've also dealt with GVTC, Nokia, TRS. So a lot of folks do approach retirement and have an option of continuing to be covered under a group health plan or a retiree plan. And most of those have what I would call a plan description that's available to the employee that's provided to them, or we can get it simply by calling the company and saying, can you send us a plan description? And it goes through and it shows you your premium, your deductible, your annual out-of-pocket costs, your prescription drug costs, if applicable, and your copays. So they do pamphlets just like they do for general Medicare plans.
Okay, thank you.
Of course, my pleasure. And I'm very thankful to the Mammon Library in Bethany for hosting this. We've helped a lot of people get coverage